And so when we look into the gut health, we also look into the permeability and the barriers and the integrity, as I like to call it, of the gut. As we all know, the primary function of the small intestine is to absorb nutrients that are essential for our function. It is about 22 to 25 feet long and have 4 layers and blood vessels. The contraction of muscle walls, called peristalsis, moves foods particles throughout the intestine. So after we eat a meal, it moves into the stomach and then moves along the intestine while enzymes break down this food. The intestinal villi are small, finger-like projections that extend into the center of the small intestine, and each vilus is approximately 0.5 to 1.6 millimeter in length and have many small microvilli that are finger-like mini villi that are projecting from the small intestine cells. This design helps us to increase the surface area for absorption of food and nutrients, and blood vessels carry those nutrients into the portal vein towards the liver, and fats are reabsorbed into the lymph system. Each vilus absorbs amino acid and simple sugars through diffusion, which means that these nutrients must be close to the surface of the vilus. Now, in the picture above, you can see the tight junctions that are located in between the intestinal cells. Tight junctions are multi-protein junctions, which prevents leakage of those molecules, such as the food, the water, the bacteria, the chemicals that we are consuming through the intestinal cells. So, for example, many of our foods are stored in plastic, and plastic has BPA that unfortunately is leaking slowly into our food and then can be absorbed through these gut barriers. And there are several types of tight junctions as part of their function, and they also prevent most movement between the cells. Now, why is that important to understand the function and the integrity of those tight junctions? Because a healthy tight junction is essential in keeping partially digested food or proteins, toxins, and bacteria in the gut and prevent those from entering into the bloodstream or other parts of our body. And you can see here in this picture the tight junction, and you can see the 2 cells on the top in the circle, and you can see that little gate, that little door there. That is a simulation of a tight junction, oversimplification of a tight junction. But you can see different particles, bacteria, food, chemicals that we're exposed to that are not supposed to enter the bloodstream. They're supposed to be broken down and eliminated through our bowel movement eventually. So when we have an increase of the intestinal permeability, you can see that in the picture below, what happens is this is a condition in which the tight junction, that gate opens up, right? And this is what some practitioners refer to as leaky gut. You probably heard that term. And essentially, what that does, that expansion allows particles to move, particles of undigested food, toxins, and bacteria to move from the intestine into the body. There are multiple factors that impact the integrity of our gut and function. One of them, for example, is zonulin. Secretion of zonulin can lead to opening of those tight junctions. And again, that's what we call increased intestinal permeability. So there is increasing evidence in study that is now showing us that increased intestinal permeability might lead to overactivation of the immune system and to chronic inflammation. In this picture, you can see a few of the symptoms and conditions that you might already see in your patients that might be associated with leaky gut syndrome. So, for example, patients that have chronic sinusitis, brain fog, chronic fatigue, digestion problems, food sensitivities or allergies, or inflammatory conditions such as joint pain. We mentioned a few of those triggers that trigger zonulin, and zonulin is that compound that is released and leading to the opening of those tight junctions. And Dr. Fasano reported that gluten bacteria can trigger the secretion of zonulin. High sugar and fructose can also cause the loss of tight junction protein, occludin and ZO1, which will eventually lead this degradation and loss of proteins can lead to dysfunctional tight junctions. So Dr. Fasano is the director of the Celiac Disease Center at the University of Maryland, and he discovered that tight junctions can open and close, and that gluten can relax and open those junctions. And he wrote, the reality is that the paracellular space is a gate, not a wall or a fence, and if material gets through that space, even if it is only 1 to 5% of what normally travels through the cell, it could be associated with disease. I want to share with you this interesting study that explained to us the process of developing an inflammatory reaction or an autoimmune condition that is related to the gut. This is a process, chain of events with 4 steps that could lead to chronic inflammatory disease. You can see from left to right. The first one is under physiological healthy circumstances, there is a tight control of the mucosal antigen trafficking. This is basically a process in which antigens such as different proteins are presented to determine if an immune response is needed. That could be in reaction to a food, a sandwich that you just ate, or chemicals that you were exposed to because of your drinking water or other foods that you were eating. And this process works together with the specific immune cells and chemokines and cytokines lead to an anergy, which is a state of immune responsiveness, right? And eventually this leads to what we refer to as mucosal tolerance, right? And so our body defense mechanism and immune cells do not react to foreign substances and consists of a direct induction of peripheral lymphocyte tolerance. In other words, this is a healthy process in which our immune system is basically remaining calm in the presence of different antigens from food, from chemicals, and it prevents our body from initiating an inflammatory response. These cells that are involved in this state of anergy, which is again a healthy state of balanced immune system, those are dendritic cells, interleukin 10, transforming growth factor beta, regulatory T cells, and that downregulates the immune system and a preserving a state of immune unresponsiveness. This is a healthy state that we want our patients to be in. As we learn in one of our modules, functional immunology, we understand that some cytokines like interleukin 10 and Tregs are important for maintaining healthy immune response and preventing chronic inflammation. In state number 2, we have gut dysbiosis, which means that we have overgrowth of certain bacteria, alternation of the bacteria in our gut, and that increases the production or risk of production of zonulin, which leads to the functional loss of the gut barrier function. This is followed by a microbiota-derived antigen and endotoxin transition from the lumen to the bloodstream. So endotoxin is a condition that occurs when bacteria, certain type of bacteria, start to migrate in from the gut into the bloodstream. This is a minor transition of the bacteria and bacteria-related waste into the body from the gut. And in general, endotoxemia is a biologically active material derived from bacteria that can affect many human organ systems and disrupt humoral and cellular host mediation system. This is where we're starting to see the immune system approaching those bacterial parts and starting to develop an immune reaction, not just in our gut, but also in our bloodstream. In state number 3, if this condition is progressed and the patient have not encountered a provider that is well educated about this topic, knows how to diagnose it and address it, what will typically happen in state number 3, the adaptive immune response is mounted, leading to the production of pro-inflammatory cytokines including interferon gamma and tumor necrosis factor alpha, that causes further opening of the paracellular pathway to the passage of antigens. This is basically a vicious cycle that keeps on driving more and more of those bacterial waste and different particles into the bloodstream. In state number 4, eventually, as this process progresses, it leads to the break of tolerance, which triggers a chronic inflammatory disease. Which disease and what is the target organ? Is it going to be the joint? Is it going to be the liver, the heart, the brain? Which organ or tissue will be impacted? That will be determined by the patient's specific genetic background, as well as additional factors such as environmental factors, the patient's diet, and lifestyle. Essentially, in epigenetics, we all have a predisposition for a certain condition, right? Those are the gifts that we get from our parents and grandparents. But this is a great example on how our diet, gut function, gut integrity, and the ecosystem inside our gut can pull the trigger and activate those genes of disease. It's really, really important. And if the take home from this presentation is that it's really important to understand how the gut flora, integrity, and function and metabolism play a role in different chronic conditions. Even the lack of certain metabolism of certain nutrients, or the chronic migration of bacterial toxins through the gut into the bloodstream can continuously flare up your patient's conditions. It can contribute to other conditions or complications. And so it's really important to understand that. And there are specific treatment protocols, including nutritional supplements, that you can use and recommend to help your patients. And as I mentioned, we have a specific classes on the gut-brain axis, which is the two-way biochemical signaling pathway that takes place between the gastrointestinal tract and the central nervous system. And several studies have already established the connection between the gut function integrity and neuroinflammation, cognitive function, autism spectrum disorder, and several mood disorders such as anxiety and depression.